would you say your favorite success story is? What's the one that hit you the most?
Wow, so that's a great question, and I think that I look at all kinds of different cases, so
Yeah.
from the hey, I want to feel better in my body, to the I've worked with patients to getting them off of medications,
Yeah.
or at least lowering doses of medications. Welcome to Beyond the Scale. I'm Dr. Minera, and today I am going to flip the scripts a little bit. Usually I'll be doing all the questions and interviewing our guests, but today I'd like to introduce Megan Wesley. She's my right-hand person, my office assistant, my practice manager, my
I have a couple
nurse, wears a couple hats. And today she's going to interview me, give you guys an idea of how we got into doing what we're doing and following this journey with all our patients. So again, Megan, welcome. Thank you so much for coming in today.
Thank you.
And yeah, so I'll have you take it away, and I'm more than happy to answer the questions that you have for me.
All right, I'm going to grill you. I'm
Good.
going to grill you. One of the things I wanted to talk about was Dr. Minera. I've known you for over 20 years. And the reason that I am so proud to be doing this with you is because you helped me. You've helped my family. You've helped everybody I love. I trust you. I trust you with my life. I trust you with all of it. So I hope people will see that when they get to talk with you, because you're not like a lot of doctors out there. And specifically for weight loss, being a patient that's gone through that, it's really hard to find a doctor to listen and to actually care. You guys are pressured on a lot of things. As a nurse, I mean, geez, I understand the pressure, but to have someone who truly cares and listen, that means everything. It really does. So I just want to put that out there. When it comes to weight loss, you helped me. Well, it's over 10 years ago, but I've known you for 20 because, gosh, I was a baby ICU nurse back then, and your patients, I'd have to call you in the middle of the night. Hey, Dr. Minera, what do you want to do about this? And how is this going to work? You were always so gracious, so kind, and so supportive. That really made me want to be your patient, because I saw the way that you cared for the patients in the hospital. You cared. At 2:00 in the morning, you're like, yes, no problem. What's up? What's going on? I loved that. I loved that. And so over the years, you were my primary doctor. And what was amazing was when you went into obesity medicine. That's one of my big questions for you is why? Why did you decide to go into obesity medicine? I'm grateful you did. Grateful you did. But why did you decide to do it?
Well, first and foremost, thanks for all the accolades. But, in all honesty, I really do. And, cliche as it may sound, but it's true. I really do enjoy what I do. And I've enjoyed every single step of the way also, and we've grown together. I know that for a fact, from, like you said, your starts in the ICU to where we are today. So again, I really appreciate that. It's interesting how I ended up, in this specialty. I initially started out with a lot of interest in how sports nutrition and sports training in general was, should be scientifically based. So back in medical school, and part of our graduating process was I had to write a thesis for graduation, and I worked with athletes, and I worked with triathletes specifically because back in the day I was very active in that sport. And I was very interested in seeing how the body reacted, to that stress in triathlon. That is what my graduation thesis was about, and then that segued into my own pursuit of athletic excellence, we would say. Fast forward to my residency, I trained in New Jersey Med School, and I had the opportunity there to work with a clinical nutritionist. And at that time, I was dabbling in long distance triathlons, and I was looking for a method or support or a system of being able to nourish myself through a prolonged event like an Ironman triathlon is, 12 hours plus of nonstop physical activity. So I figured I needed a little bit of help to get that done. And so I started to really delve deep into sports nutrition and nutrition in general. That kind of segued into my passion for nutrition as a means for treating disease processes, and in primary care, a lot of the things that we see day to day is definitely genetic, but it's nature and nurture, like we like to say. So I wanted to see if there was a way that, in addition to us helping patients, could they also take a little bit more control of their health. And that led me to realize that a lot of the processes that I was treating could be prevented, or at least helped or improved, by proper nutrition and ideal weight, and treating the underlying cause, which was being overweight. And so I started to look at, and this was back probably about a good 12, 13 years or more ago, into a kind of like a entity that would provide that kind of education. And so that's when the beginnings of the American Association of Obesity Medicine, and all these different specializing agencies were starting out with some of their courses, some of the training, delving into a little bit more of the endocrinological, the medical. So I started taking some courses at that time, and it just snowballed into getting to a point where I was collaborating with a cardiologist who was very much into nutrition and controlling a patient's overall body weight and whatnot for health and nutrition. And he board certified in obesity medicine, and that inspired me to pursue the same pathway, and then to back what I was doing. I've always been very intent on making sure that what I'm doing has the medical backing, has the evidence-based,
credible.
Exactly. The credentials for me are very important, because it gives what we're doing legitimacy, and it also provides a reassurance to the patient that we're not just winging it, that we know exactly what we're doing, that there's a method to the madness. So about 4 or 5 years ago, I sat for my boards, and through the American Board of Obesity Medicine, became a board certified obesity specialist. And that's when I decided to, do this
change all these
full time.
lives.
Yeah. So from primary care and working with my primary care patients who needed, some help with the losing weight, to now doing it full time.
You do great at it. You do absolutely great at it. What would you say your favorite success story is? What's the one that hit you the most?
Wow, so that's a great question, and I think that I look at all kinds of different cases, so from the hey, I want to feel better in my body, to the I've worked with patients to getting them off of medications, or at least lowering doses of medications. I think that the being obviously, my passion being in medicine, and again, the evidence-based component of it, when I'm able to help patients come off of medications or lower the doses of the medicine, that means a lot to me. But I have to say, and this is really interesting, because, I feel that I have been influential in helping patients. At the end of the day, you can lead somebody, to water, like they say, but you can't force them to drink. So, I don't take anything away from, obviously, the patient's contribution. I have, the knowledge base, but ultimately it's their dedication and it's their commitment to their health that gets them to where they need to be. But there's one particular case that really stands out, and that's in a patient, a pediatric patient actually, who was 15 or 16 years old, and she was really, really struggling with her weight. And she also, was suffering from a lot of the stigma, the bullying, everything you can
Yeah.
imagine, a kid goes through.
Oh, jeez.
And she had tried, through different means. Unfortunately, there's a lack of knowledge and education out there, even amongst, professionals,
Right.
and physicians. And they really didn't know how to help her. So her mother, through one of her friends, saw that her friend was having a lot of success with me. And so she decided to take a chance on us and
Wow.
brought her daughter to me. Last I got to see her, she was at least 60, 70, maybe even 80 pounds lighter. More importantly, she had regained her confidence. She was socializing again. She was back out there,
Oh my gosh.
being a teenager,
Yeah.
not having to carry this stigma, not having to carry this.
Well, I'm glad you bring up
this
the
weight.
stigma, because there's a stigma. I think society has a stigma with being overweight. Just because you're overweight doesn't mean that you're a bad person. I know I struggled so much with that. Losing 130 pounds is a lot to lose, but you start feeling like you're the problem. And you made a really good point, but there is a lot out there. It's almost too much information out there for people, but it's not all the right information. And so the stigma, one of the questions I had for you about what you're changing in obesity medicine, is not only the stigma in the medical practice, but the stigma with patients, because they feel it. They have that stigma that they walk through every day, and you help them put that down. How do you do that? That is magic.
Well, I think one of the main problems is that we've made it acceptable
Yeah.
to discriminate against, patients who are overweight and obese. There are statistics out there, and there's actually, the introductory chapter to one of the books that I've read states that, it is still the only acceptable means or form of discrimination that still exists to this day in this country. You can't be discriminated against for, your religion, for your color, for your background, for your culture. But no one bats a lash at discriminating against somebody who's obese or overweight and making them feel guilty and responsible for, a condition that we know is driven by so many variables and so many factors. So I think that that's where it comes in, is again, so you ask, why is it a stigma? Why is it a problem? Because we allow it to be, it's still an acceptable form of that discrimination. And unfortunately, it's still very much so, even amongst, again, professionals and medical providers. There's studies that show that, these our patients who are overweight are treated poorly,
Right. By other medical professionals.
By other medical professionals, by people in stores, clerks. When you see somebody who's overweight, automatically, the thought process is, the judgment is there. The thought is that, you choose to be this way. It's a lifestyle choice, and it's much more complicated than that. Sadly enough, and I know a lot of people may be shocked by this statistic, and also maybe in disbelief, and to a certain degree, opens me up to maybe being criticized for it. But when they look at the quality of life of obese pediatric patients, their quality of life is as poor as a patient who's going through cancer chemotherapy treatments at that age. And so again, the quality of life is very, very low. And again, it's shocking, to think, how can you compare that, a cancer patient to a child who's overweight and doesn't have cancer? Well, that we're looking at, what society has done, to these kids. And so the first thing I tell patients is, get that monkey off your back. You're allowed to be who you are here, and you're safe. And let me just help you, educate you, and realize, that there's much more to this than just what we can see on the surface and what people see on the surface. Genetics, access to food, lack of education. We talk about it all the time. And I think that peeling those layers of the onion, so to say, is what I like to say, helps us get to a certain place. But I think that the first step is giving patients a place to feel safe and to feel
heard, absolutely,
understood,
absolutely,
and supported in general. Yeah. And then empowering that patient to understand
I
the
finally
situation.
had hope. I mean, just to be completely transparent, I finally had hope after talking with you. I mean, that was one of the hardest things for me. You named the diet. I tried it. And I also was like, I'm not eating. I'm not, just because, at that time it was don't eat as much. So I didn't eat as much and I was not healthy. That was not the way to do it. I was eating a salad a day. It was horrible for me, but I wanted to lose weight. And you're like, Megan, Megan, let's look at this here. Like, stop trying to run the marathon. Like, let's make you healthy. And I absolutely appreciate your approach in comprehensive care, because you really do look at the whole person, the holistic approach, like all of it. You take all of it in consideration. And mental health is a huge one. I mean, the kids, like you're talking about, everybody has a vulnerable piece to them. You are an angel for letting that vulnerability be able to be set down, and you make this connection with people that are struggling. And you look at it from not just medication, you look at it from nutrition, you look at the comprehensive overview. It's like, hello, this is what we should have been doing for so long.
And I'm glad you mentioned that, because I mean, in all honesty, I think, again, you look at where we are today with the overweight obesity epidemic, and unfortunately, again, it's been kind of like thrown into the whole cosmetic categorization, and come get your best Ozempic, come get your best GLP-1, come get your best whatever the medication may be. And it's not just about that. It's a lot more. It's a lot more. And then giving the patient, like I said, options and the ability to realize that it is an individualized approach is very important to us. And so having those conversations, I think, is key to success.
Absolutely. Mm-hmm. Absolutely. No, I mean, and I've seen a lot of your patients succeed, and the way that they smile, the way that they feel about themselves, even though they're on their journey. I've never felt ashamed or bullied into I didn't do well enough. I didn't lose enough weight. It wasn't about that. It was, like you said, it's how you feel. It's how you are you healthier? It's not just the number on the scale. This is beyond the scale.
and we always, and the other thing is that I we always strive to find a better way to do it, and it hasn't been easy. Hasn't been easy because, again, not everybody accepts that this is truly a medical condition. And so, finding and talking about why I, ended up doing this as a specialty. I went from treating primary care and incorporating the weight loss into my practice to then opening up a weight loss obesity practice within a primary care office, to now doing it as a standalone, and trying to offer all of the different options, what we call the pillars of weight management, has been fun. I mean, been here, done that, I mean, it's been
learning. I'm still learning.
It's a challenge, it's a challenge. And how do you incorporate everything you need, and how do you spend the time you need to spend with the patient? And how do you, get people to realize that, it is necessary to provide a comprehensive approach, So I guess going back to your original question of why do I do this? Because I want to hopefully continue to promote the need for what we're doing, and create a system that allows us to do it efficiently and compassionately, and it's a balance. There's no script out there. You and I have had this conversation before. There's no formula out there. There isn't a checklist where it's like, okay, A, B, C, D, and here you go. You've got a weight loss, office or clinic out here that works. It's a work in progress, and so that's why we're here today, having this conversation, because part of this is advocacy.
Yeah.
which is very important to me as well. Advocating for my patients, advocating for the specialty, and hopefully, creating resources so we can reach, more people who need it. Let's be real. Losing weight and getting healthy is confusing. One person says carbs are the enemy. Another says you need to eat more of them. Some say lift heavy, others say just do cardio. So who's actually right? That's exactly why we're doing this podcast. I'm sitting down with real health professionals, not just in weight loss, but in fitness, recovery, strength, and medicine, to cut through the noise and give you the truth about what actually works. No fads, no gimmicks, just real conversations about getting healthy, staying strong, and feeling your best for life. If you're tired of guesswork and ready for real answers, click the link below and let's start making sense of health together.
The support's incredible. What would you say that you've learned over the years that you've been doing this, the support at home versus the support in a program? I know as a working mom, the stuff I was cooking for myself wasn't what I was cooking for my kids or my husband. They didn't want to eat any of it. So that was difficult. That's just one added layer of making it harder for people to stay healthy. That was one of my challenges. What are the challenges that you've seen from the years that you've been doing this to keep people on track and accountable?
So I think the biggest challenge is that with weight loss, it's always been looked at as there's an endpoint. Okay.
Right.
So, today I'm 100 pounds overweight and my endpoint is to lose 100 pounds. Well, it doesn't end with that 100-pound weight loss.
Yeah.
Whatever your goal may be, it is a lifestyle. It's a long-term, chronic, situation. And like anything you're going to succeed in long-term, it requires a long-term approach, right? So again, you may have a goal of losing 50, 60, or 70 pounds, but that is not by any means, the end of it. That's like, okay, I've lost this amount of weight and now I need to, continue to work with my provider or continue to work, with the tools that I have learned to maintain and sustain that in a healthy manner. One of the things, and I'm glad you mentioned it, that I'm trying to, also communicate to parents is that, it's not too early to start.
Right.
And a lot of times I see, patients, moms, dads, cooking for themselves and then cooking for their kids. Well, it should be integrated into a family approach of health. So you should start early on showing kids that it's very, very important, to eat well, to, move, physical activity, of course, within, the confines of, what each individual's ability is. But, there's no time or endpoint to health. It's a continuous process, with ebbs and flows, and it's a work in progress.
Yeah, no, it really is. It really is. One of my questions for you, because this is where I'm at in life, with hormones, with menopause, with all the things that women have to juggle. And I'm not trying to make this a guys versus girl thing, but for women going through hormonal changes, how have you been able to identify with what you've been doing? How have you, I guess I want to kind of pick your brain on when you see someone going through menopause, what areas related to weight are really what women should be thinking about when, hey, I'm going through menopause. Maybe I should talk to my doctor about this. Am I going to gain weight because of it? Am I going to, I know it's a very general question for a very specific mode, but what would you say? What would you say for people?
So, it's interesting because I'm sure there are a lot of questions and a lot of variables, like we talked about, and I think that's a very, very important point there. There are obviously a lot of factors, not only in women, but also in men and even in children. And you and I had a conversation before about how incredibly fascinating bariatric endocrinology is to me. And so I've educated myself much more in that particular area, from the influences of diabetes and how, as a bariatric specialist, I choose to manage diabetes. The lens that I see things from is, can I treat a medical condition and at the same time derive benefits with helping a patient lose weight? So when it comes to women's health, it's very interesting. There is a lot of new data coming out that we need to definitely address: the menopausal component, or the perimenopause and transition through menopause, because 100% of women who live beyond that are going to experience it. It's not a matter of if, it's a matter of when. And
I think you told me we were driving probably to get stuff at the office, I think, and I kept rolling the window down, and you're like, "Are you having a hot flash?"
Yeah.
I'm like, "Oh my God, is this is it? Oh my God, I'm having a hot flash."
Yeah.
So now it's happening. So yeah, like I need to know all about it.
Well, and I'm glad you bring that up, because traditionally, as physicians, the training we get, again, about an hour lecture at most, when we're going through medical school. And there was, there's a great physician, Dr. Haver, who has a menopausal practice in Louisiana, who mentioned that the traditional treatment has been based on whether do you have hot flashes, or do you have sexual dysfunction, and those are the two areas that we have always been taught to address. If the answer to those areas is no, then we don't treat it. Well, it goes above and beyond. There's a lot of data coming out now about how influential the menopausal phase or transition is for women. And specifically speaking to weight and struggles with weight loss, we've noticed that an estrogen deficiency usually will lead to redistribution of body weight, specifically body fat, where there is a higher tendency for that to distribute to the midsection, as opposed to what the natural distribution of body fat is in a woman who's not going through that. Add to that, the physical signs and symptoms of the hot flashes, the gynecological component, the mood swings,
I don't know what you're talking about.
People talk about brain fog, people talk about, so many different things. And yes, there is a lot of evidence pointing towards the influence that it has on metabolic health in general. And if you recall, from our conversations, what gets a patient through the door is, "Hey doc, I want to lose weight. Once I capture you here, I want you to lose excess unhealthy body fat. But at the same time, what I'm trying to do is correct metabolic dysfunction." And a lot of that metabolic dysfunction is driven by endocrinological changes that happen during the like I said, perimenopausal, menopausal transitional phase. And that's definitely, some subject that we can discuss, at a complete podcast in and of itself. But yes, it's very important for your provider, whoever that is, who's helping you with weight loss, to understand and be educated and versed in that area, in that topic.
It was interesting for me talking with you about women's health and hormone replacement therapy, and that when I was in nursing school, long time ago, we were taught it was awful. You can't give hormone replacement. It will give you cancer. It is horrible, horrible, horrible. I had this stigma in my head. And like you said, now there's a lot more data coming out. There's a lot more studies done. Is there still, you think, a stigma in the medical field with medical providers doing I'm not putting them down by any means. They're doing the best they can.
Sure.
But it's almost like you're changing the pathway, kind of like changing the script now, because that's not horrible to have, and it's actually something that could help you prevent even worse things from happening in your life if you need it, hormone replacement therapy.
Yeah, I think we all go into medicine, to help people, just like any other career path. I think everybody is in it to help, their fellow human being. And I think the Hippocratic Oath has always been, first do no harm.
Right.
And I don't think there's anybody out there, intentionally trying
Right.
to either, do harm or, avoid something that's going to, improve a patient's quality of life. Unfortunately, though, a lot of the information that we did have about perimenopause and menopause was based on a 2001 study, and the interpretation of that still is something that a lot of providers hang on to. Again, I think that we, as scientists and as a scientific community, have a fiduciary responsibility towards our patients to be informed and to understand the data and to understand how to interpret the data.
Right.
And I think that at that time, the interpretation of the data led us to a certain practice, which was take everybody off of, hormone therapy. Since then, it's been reanalyzed and it's been, restated that that's not the case. Unfortunately, if you're not continuously keeping up with the data and information coming out, you may not be up to date in that particular area. So that happens with pre, peri, and post menopause. That we're still, unfortunately, practicing medicine like we did in 2001, and times have changed. We understand that there is definitely a huge benefit looking at your patient population, looking at each patient individually, very, very important, what the pros and the cons are, having that open discussion, but not sending your patient out the door saying there's nothing I can do for you. Right. If you're not comfortable with managing, something of that sort, then, we all understand, we know what we know. But more importantly, like I used to tell the residents I trained in the past was, understand what you don't know. And then when you don't know it, give patients options of who to see so they can have that conversation. Yeah. So that's what I think is important. Not you don't have to know everything, but at least know somebody who knows what you don't, and then refer your patients there. Quality of life is very, very important. Absolutely. And it's part of the struggle too with weight loss. If you're not feeling your best, you're not at your best, you're not going to be able to
100%,
be your best.
100%. I before you and I really started working on my issues with my body, I really felt kind of like ping ponged in society. There's all this stuff out there. Eat this, don't eat that. Don't eat, just don't eat. That's not healthy either. For me, it might be healthy, but for you, it might not be healthy. And that's one of the things, many of the things that when you're looking at a patient, I appreciate that you look at their, not just how old they are, but what they went through. How many yo-yo diets did you go on? I mean, because that does damage to your body. I don't think people understand, because I didn't. I was trying really hard to be healthy, but that yo-yo dieting made it a lot worse for me. And I probably had a lot of more inflammation happening because of it, instead of just sticking with my provider one-on-one saying, how can you help guide me on this journey? So there was so much that was confusing out there, and there's still a lot out there that's confusing for patients, and they'll take a TikTok, and I'm guilty of it, take a TikTok or a Google search, and not realize that's not the whole picture. That a peptide might work for one person, but that's really not, you're not looking at this whole picture the right way if you're just thinking one pill's going to fix it. That's not safe. What are your thoughts on everybody probably asking you that same question? What's the one pill that can help me, fix my life?
I think one of the important things that you mentioned is, the confusion and everything out there, do this, don't do that. One of the things I think that's very important, and I heard this from somebody, a little while ago, is that it's become, the wellness movement is very important. And I think it's a positive thing, but we can't confuse the wellness movement with not being accepting of uh, medical advice and conventional treatment. So advocating for yourself and informing yourself, I think, is important, but finding guidance and bringing those questions and those concerns to a trusted provider is very, very important. I don't think that a patient should try to navigate, this complicated world on their own. I do think they need to advocate for themselves and ask the questions, but they need to have that open conversation and the back and forth with somebody who is educated and in the subject, and also who is willing to allow a patient to be participate in that back and forth as well. So that's the important thing. Yes, it can be very, very confusing, even as a provider.
Yeah.
And we've been, through medical school, college residencies. I mean, when you look at, 12, 15 years worth of education, and we're still learning as we go along, I think that, you have to have that collaborative
approach,
relationship with somebody who can guide you.
What are the I know we've had this conversation many times, but what I'm really excited about too is the advancements in obesity medicine. And you've taught me just some, not even, we haven't even had time to talk about the stuff that's coming out, but what are you excited about technology wise that'll help more patients with this?
Yeah, one of the biggest things I think that I was very excited about was the ability to genetically test for different mutations, different genetic sequences that actually contribute to weight gain. And once you're able to do that and then communicate to the world that, hey, this isn't just a lack of effort. This isn't a character flaw. This isn't a laziness situation as to why, my patient is where they are. That's what I feel has been one of the biggest advances and what I'm always, looking at and very excited about. And not only being able to test genetically, but then once you discover that there is a problem, then being able to treat it.
Right.
And that's where we stand right now with the science of overweight and obesity. Also looking at all the different, medications that are coming out. Again, I don't think that anybody should be afraid, ashamed, or, shy away from using the tools that we have. And remember, it's only a tool, right? One of many tools that we have. Lifestyle is important, physical activity is important. But then embracing the science and saying, well, you know what, thank goodness that we're living in a time where science is to my benefit, and I can utilize it as one of the many tools available to ensure, my health, and success for me is not measured, like we say, beyond the scale. It's not measured just by numbers. It's measured by, metabolic health, and it's measured by increasing confidence. It's measured by, hey, you know what? I wasn't able to, get down on the floor and play with my grandkids and then stand up on my own. I've done that, So it's the little victories. It's again, that improvement in quality of life. And so I'm excited about word getting out there and the advocacy for the specialty.
We talked about a lot. Today, and I'm going to pick your brain more, a lot more, but probably don't have enough time on this episode. But I'm excited. I'm excited to tune in and hear more.
I want to thank you a lot, for the opportunity, Megan. Thanks so much for doing this with me. I think, it's definitely will open up the doors for so many other things to discuss, so many other topics that we know are incredibly important and of interest to our audience for sure. So thank you for taking the time for interviewing me. I feel that I've been able to let people know what we're about and, what we have in store for them. So thank you so much. And I look forward to future interviews from you.
Okay.
And with that, we will be having some more guests, come to our podcast. And so we look forward to publishing the next episode. of Beyond the Scale with Dr. Minera. So thank you for listening. We really appreciate you being here.